Hi, this is Anchor Shivani Gupta, and I am glad to invite both of you to the most prestigious event of Anicon 2022. And here we at IPCA, we are here to create a revolution against winning over epilepsy. So, sir, I would like to know something from you. Before that, I would like to know your name.
Hi, I am Dr. Navanil Barua. I am the Director of Neurosurgery, GNRC Group of Hospitals, and of course, as a neurosurgeon, I do deal with epilepsy.
And sir,
I am Dr. Roopjyoti Hazarika. I am a consultant neurosurgeon at Dispur Hospital and Koras Pratiksha Hospital, Guwahati.
right, sir, it's a pleasure to meet you. And sir, I would like to ask you a few questions. Sir, what is the most common myth which you have heard about epilepsy?
The most common myth which I think is epilepsy is congenital, that means it's transmitted family-wise. Number two myth is that epilepsy can be cured by giving, smelly socks or something smelly into your thing. It can be cured, the attack can be stopped. So these two are very popular myths. Which
The most common one, if I'm not wrong.
Yes, it's very common myth, but they are myth. They are not truth.
Right. And sir, how far do you think there is, epilepsy is still there because of the unawareness about it? So how far do you think that this is the right statement?
Yeah, it is to some extent it is correct because epilepsy can develop even a newborn child and it may continue in the progress in the future life also. And most of the time at that moment of time actually we miss those patients. And it can happen because during the birth process itself, because most of the rural areas where the birth is still in home basis, there's a prolonged stage of labor, child goes for the after delivery for hypoxia or some kind of infections leads to the epilepsy or maybe CNS infection, and that gradually progressed into the stage of epilepsy, which probably we miss in most of the time.
Right. And sir, you meet so many patients all the year long. I would like to know that can the patient who is already having epilepsy can lead a normal life?
Absolutely. I mean, that is the biggest tragedy. We treat epileptics as some kind of retards or some kind of deficient people. Absolutely not. I mean, I can cite number of examples. People who are Roman conquerors, people who are experts in their fields, excellent players, one of the best fielders in the world, John T. Rhodes is an epileptic. There are so many of them. So epileptics can lead a normal life. They can even drive. Now, well-controlled epileptic can drive. Secondly, they can play any kind of games. They can lead a normal life. They can marry. They can have children. They can have a normal sexual life as well.
That's really nice. And then coming up to you, sir, I would really like to know, along with the medicines, what are the other treatments that the person can go through, and it can be, that can be an easy process for them.
Yeah, actually, before telling about the treatment I just want to tell the people that epilepsy, if you have seizure disorder, you should not feel ashamed to tell the people or tell the doctors. It is as sir has said, it's not a congenital disease. It doesn't spread to the other human being. And first of all, we as a patient, we as a family member, we should accept that yes, I have an epilepsy. For example, if other conditions, like if somebody has a cardiac problem, people accept it. I have a cardiac problem. I have to take BP medicines. I have to take medicines for a long time for the cardiac ailments. Similarly, if you have somebody with epilepsy, he has to accept it. And apart from medicine, he has to have little bit of disciplined life. The most part is that he should have sufficient amount of time for the rest. He should have food at regular intervals of time. And whenever he goes outside like a bright sunlight or stressful, they should be able to reduce the stress. That's the most important one. You have to be very disciplined. You have to accept it and lead a normal life. That's all.
Thank you so much, sir. Sir, one last question from you. Would you like to say something? What people who are already going through this epilepsy should eat and what they should not eat?
Actually, we put too much of stress on the food. If you are a well-controlled epileptic, there is no food restriction. But if you are having problems with thing, we go for something called a ketogenic diet. That is very, very technical. I know I'm not going to the details, but there is no food restriction for epileptic. However, I strongly recommend that psychotropic drugs and substances, epileptic should never think of it. Nobody should think of it. Epileptic more. Alcohol also should be in moderation. Never go overboard on that. Especially binge drinking is very dangerous for an epileptic, and smoking obviously is bad for every person, whether he is sick or not.
Right. Thank you so much, sir, and thank you for joining IPCA. It was a pleasure to have you here. And I hope this is going to help a lot of patients who are suffering from epilepsy, and this is going to help them a lot. Thank you so much, sir. Thank you.